down. It's going down. It's going down.
Hello everyone, as for today's video is about cancer, I will talk briefly about cancer and later I will talk more about the lifestyle after diagnosed with cancer. Cancer has 4 stages, where stage 1, 2 and 3 still can be treated to get rid of cancer cells that in the body that will form a tumor. But for cancer stage 4, it's quite difficult for a person to fully cure. But then they can rely on chemotherapy treatment and medication given. Therefore, let us know more about the symptoms of cancer so that we can take early steps to treat it so that the cancer cells do not spread and infect other organs of the body. The symptoms are lumps on the limbs, such as on the breast or armpits. A painless lumps that arise on the limbs is an early sign of cancer. This is because most of cancer can be detected by the lumps on the surface of skin. The next symptom is continuous coughing. This will make the voice become hoarse, and this is also will make the individuals difficult to communicate with the others. In addition, the symptoms are drastic weight loss. This is said to be so because almost 40% of cancer patients experience the weight loss when they are diagnosed with cancer. Weight loss of more than 5 kg in short period of time is not normal for the individual that is not on diet. The lifestyle of individuals diagnosed with cancer change in terms of nutrition, because apart from chemotherapy treatment, taking medication is one of the ways to reduce the pain experience. That medicine can be said to be as a mandatory food for every cancer patient because they need to eat it on daily basis. If a healthy person eat dessert every day, but the cancer patient need to take different type of medicine on a daily basis. Next, their lifestyle also change in terms of daily activities, as their daily activities become limited because there are things that can be done and there are also things that cannot be done. This is because their bodies are getting weaker and they are not allowed to do strenuous activities. In addition, their time also become limited as they have to undergo chemotherapy treatment. Before I end this video, I want everyone, especially cancer patients, to be patient with the illness that you are facing. You have to remember that everyone has a problem to face, but you can fight your problem with God, which is keep praying that everything will be easier. So if you are having problem or worrying about something, leave it to Allah. Pray and make dua for it. And if that thing did not work out like what you want it to be, do not be disappointed. For indeed, Allah has better plan for you. So lastly, whenever you feel weak, you have to remember the things that have made you strong.
Now I will talk about cause cancer. Cancer is caused by chance or mutation to the DNA within cells. The DNA inside a cell packaged into a large number of individual genes, each of which contain a set instruction telling the cell what the function to perform as well as how to grow and divide. Error in the instruction can cause the cell to stop its normal function and may allow cell to become cancerous. What do genes the mutation do? A gene mutation can instruct a healthy cell to allow rapid growth. A gene mutation can tell a cell to grow, divide from rapidly. Fail to stop uncontrolled. Cell grow normal. Cell know when to stop growing so that you have just the right number of each type of cell. Cancer cell of control tumor suppress genes that they'll tend to stop growing. A mutation tumor suppress generous low. Make a mistake when a repairing DNA error, DNA repair gene look for error in a cell DNA and make corrections. Okay, now how about a cancer treatment? Okay, cancer treatments may be used as a primary treatment. The goal of a primary treatment is to completely remove the cancer from your body or kill all the cancer cells. Any cancer treatment can be used as a primary treatment, but the most primary cancer treatment for the common type of cancer is surgery. If your cancer is particularly sensitive to radiation therapy or chemotherapy, you may receive one of the therapy as your primary treatment. Adjustment treatments. The goal of adjuvant therapy is to kill any cancer cells that may remain after primary treatment in order to reduce the chance of the cancer will recur. Any cancer treatment can be used in adjuvant therapy. Common adjuvant therapy include the chemotherapy. What you can expect, there are many cancer treatments are available. Your treatment option will depend on several factors such as a type of stage of your cancer, your general health, and your preference. Together, you and your doctor can weigh the benefits and the risks of each cancer treatment that determines which is the best. Cancer treatment in the option include surgery. The goal of surgery is to remove cancer of as much of the cancer as possible. Chemotherapy. Use a drug to kill cancer cell. Radiation therapy. Radiation therapy use a high power energy beam such as X-ray or can come from machine outside your body. External brain radiation, or it can be replaced inside your body is a braces therapy. Lastly, about activity that can be performed by cancer patients. Exercise is unimportant and of cancer treatment plan as a growing amount of research show the regular exercise greatly improve physical, mental health during every phase treatment. And when if you were not active before your cancer diagnosis, and exercise program that meet your unique need can help you got moving safely, socially benefit of exercise. Following well-designed exercise plan during and after treatment may be able to follow the chance of having a physical side effect such as fatigue, neuropathy, lymphedema, or osteoporosis and nausea. Reduce is the respiration and anxiety, keep you mobile independent as possible, improve your balance to reduce fight injuries, prevent muscular and pull strength. The amount of time you need to stay in the hospital make your treatment effective and destroy the all tumor cell, improve the survival rate for certain cancers such as breast cancer and colorectal cancer. That's all from us. Thank you.